Good evening, or good afternoon. What a great pleasure to be here, and what a pleasure to be in Australia. It's my first visit. I was explaining to colleagues that I visited every continent on the planet, save the Antarctic and Arctic, except Australia, until yesterday. So, I'm going to talk to you about nudge theory, public health, and what we can learn from the efforts that were made in the UK to introduce nudge theory from about 2010 onwards. Underlying the need for nudge theory is a belief that we can and should change people's behaviour because the scale of the problem, principally from non-communicable disease, is such, as it is here in Australia, as it is in North America, is such that the costs are rising both in human and financial terms. So from the UK, the level of tobacco use costs us about 2.7 billion a year. Health problems related to overweight and obesity, 4.2 billion. Physical inactivity, 1 billion. And chronic and acute effects of alcohol misuse, 1.7 billion. And what all of those things have in common is they involve human behaviour, human choices, human decisions. And so that inevitably leads many commentators to suppose that the answer, therefore, to this problem, these problems, resides in changing behaviour. There's another important dimension. I worked, as Andrew said, at the National Institute for Health and Care Excellence, NICE, from 2004 through till last year, the end of last year. And NICE has in its statutory instruments, the legislation which established it, a concern to understand what sorts of evidence in terms of public health interventions we can bring to bear on this schematised representation of the health inequality gradient, which, as I'm sure most people in the room are familiar, demonstrates a strong association between higher socioeconomic status, however you measure that, with high and better health status. Again, however you measure that, whether it's by mortality, morbidity, people completing questionnaires about self-experienced health, and so on. You get this kind of gradient across the total population. The gradient is important, of course, because not only does it demonstrate health differences across the population, it shows this graded movement as you change, as you move downwards in the socioeconomic scale, the health levels of health on average decline too. So written into my job description from 2004 onwards was to determine what sort of evidence one could bring to bear that would try to shift and change that gradient. And in my concluding remarks this evening, I'll say a little bit more about where we got to that. Well, if human behaviour is important, the behaviour of the state is also important. And many people will point to the history of public health and say, of course, some of the greatest benefits to the health of the population have occurred as a consequence of state regulation, of tobacco and alcohol, for example, of protecting people's health through great public works, the Thames Embankment, the sewer system in London in the 1860s, for example. Or perhaps the role of the state is to promote healthier choices. Or perhaps the role of the state, most importantly, is to protect those who can't protect themselves, children, the disadvantaged, and so on. In 2007, the English Nuffield Council on Bioethics produced what it called the Health Interventions Ladder. At the very bottom of the ladder, state options are limited to doing not very much at all, simply monitoring the current situation and taking a very non-interventionist approach. As you move up the ladder through providing information, enabling choices, guiding choices, through changing defaults in policy so people choose to do the sorts of things that might be beneficial, providing incentives, and then stronger disincentives with things like taxation, restricting choices, banning things, stopping things, or eliminating choices altogether. And I suppose most famously, at least in the United Kingdom, the most recent big elimination of choice was the introduction of smoke-free environments in public places. Now, this ladder is important, not so much in terms of its philosophical underpinnings in the philosophy of people like John Stuart Mill, so much as it points to a fundamental problem that has been central to public health since at least the the early 19th century. And of course that is the distinction or the contradiction between those things which are predominantly the responsibility of the individual to deal with, you and I as individual citizens, as adults making our decisions, as against the role of the state to make decisions for us. And if you explore the history of public health in developed countries, you see a pendulum swinging every decade or so from a focus on the state having a bigger role to the individual having the more important role. Arguments about liberty, arguments about freedom, arguments about protection. And by the time we got to 2010 in the United Kingdom, the popular press had turned this into, as they often do, a very nice catchphrase, the nanny state. And the argument was the nanny state was fundamentally a bad thing. I could find only this, perhaps the most famous nanny I could think of anyway, Mary Poppins there, bringing and telling us what we should do, nannying us through limiting our choices. And by the time we reached the general election in 2010, the nanny state was seen as a fundamentally bad place to be. That came into policy when this chap, Andrew Lansley, became the Secretary of State for Health. Now, he's very interesting because some of his pronouncements about the problems of the nanny state were really pretty critical in establishing the policy direction. But he was also very important because he brought to the table, following the election in 2010, nudge as a fundamental part of public health policy, a rejection of the nanny state in favour of the promotion of choice. And in the Public Health White Paper, which appeared in November 2010, 4 or 5 months after the election, this phrase, I think, sums up very nicely the policy direction and the importance of why nudge became so significant. It's simply not possible, the White Paper says, to promote healthier lifestyles through Whitehall diktat and nannying about the way people should live. One size fits all is no good. We need a new approach that empowers people to make healthier choices. Those of you with longer memories will recall, of course, in the 1980s, making healthier choices, easier choices, was a WHO mantra around what was then called health promotion. So, nudge, getting away from the nanny state and moving us to this situation where environments are created, or as in the phrase goes, the choice architecture, the architecture of the choices that we can make, nudge us towards making more healthier choices as we proceed. The initial impetus, I think, for the popularity of this idea, at least this time around, was Thaler and Sunstein's book, Nudge, Improving Decisions About Health, Wealth and Happiness, published in 2008, which is actually an economics book, behavioural economics, which primarily turns its attention to why consumers or why the markets don't operate in the ways that classical economic theory predicts. Behind Thaler and Sunstein is a real intellectual giant, this man, Daniel Kahneman. And his book, published actually after Nudge, but he worked with Thaler and Sunstein and was incredibly influential, I believe, in the way this developed, in his book Thinking Fast and Slow. Now, Kahneman's great insight, which arose from a series of investigations he did as a psychologist, although Kahneman in fact won the Nobel Prize for Economics, Kahneman's great insight, it seems to me, was the notion of the heuristic. That is to say that when confronted with complex problems, the human natural thing to do is to find a simple answer to actually what's a simpler problem than the complex problem that we face. We default, we think fast, in Kahneman's terms, to a situation where we find an easy solution to something that's very difficult. So, for example, if I were to say to you, can you give me your view on the possibility of England's revival as a serious test cricketing nation? I dare say everyone in the room would be able to give me a very fast answer to the proposition that we're going to win the Ashes. I mean, England is going to win the Ashes. You could give me a very fast answer to that view. Thank you. Okay, now if I said to you instead, I'd like you to calculate in your head, multiply 17 by 3,245. Can any of you do that quickly? Probably one or two mental arithmetic nuts can, but most of you would have to go through a slow process of calculating it using long multiplication. Two very simple examples of thinking fast and thinking slow. Now, Kahneman's argument is we do this all the time. Thinking fast using heuristics is actually sometimes incredibly important because we can get to decisions quickly when we need to under difficult situations. But it can also mislead because we don't then spend the time doing the complex thinking that's required. I had dinner with Daniel Kahneman last year in York. His wife was actually being presented with an honorary degree by the University of York, and I was invited along to dinner to meet them. And he was a very witty man, as well as being very clever. And the service in the restaurant was incredibly slow. And by the time we were waiting, having waited nearly 90 minutes, I think, for the main course to be served, he observed that he didn't think that the people in the kitchen needed to think quite so slowly about what to service. He's a very nice guy too. And the book, Thinking Fast and Thinking Slow, I think is one of the important books of the decade. But what Kahneman and Thaler and Sunstein and others have picked up on is something in a sense even more fundamental about the way that we think. And it's so fundamental the Greeks had already thought of it. This is Zeus. Well, it's not really. It's a statue of Zeus. And Zeus had two, among others, two sons, Apollo and Dionysus. And if you read the Greek myths about Apollo and Dionysus, you find two contrasting mindsets. Apollo was the god of order, discipline, system, predictability, and above all else of logic. His brother, the rather languid-looking young man there, Dionysus, was the god of pleasure, the vine, drunkenness, Bacchus in Roman mythology, of disorder and spontaneity. And what the Greek myths pick up on are two sides, in a sense, not so much in our personality, but two sides in the way that we approach life. And it's in all of us, on the one hand, that sense of order, predictability, thinking through difficult questions, using cognitive capacity to work through ideas, and that which takes the easy option, as Dionysus was wont to do, because it was easier, it was pleasurable, and you got there quicker. Paper published in 2004 by Strack and Deutsch calls the same thing, reviewing the psychological literature up to that point, the dual process system. And the dual process system is critical in understanding where scientifically nudge is coming from. The reflective system, the Apollonian system, the system of thinking slowly, the reflective system, that part of our minds which is reflective, goal-oriented, driven by our values and intentions, which uses expensive, energy-sapping cognitive capacity or thinking space. And in most of us, that's rather limited. And the third point is terribly important. Traditionally, most forms of public health and health education and health promotion have focused on engaging with this reflective system. If I can give you enough information about how things will be bad for you, you will act accordingly and act responsibly. It's based on providing information designed to alter beliefs and attitudes, to motivate people, and in some, as the bottom bullet point says, at best these approaches have been only modestly effective in changing behaviour. In a paper published this year, we review the literature on that, and that's the conclusion. On the other hand, the automatic system, that other side of us, which requires little or no cognitive engagement, is driven by immediate feelings and triggered by our environments, is the automatic system. A nudge, in its scientific sense, is the focus on that automatic responses to environments. And here we have Homer Simpson being nudged because the donuts are way out of reach, so he's going to have some fruit instead. because it's there. He's nudged to doing so. I wonder if he really would. This is a photograph rather out of focus, as is this, from a supermarket checkout in Marks and Spencer's in London. Now, Marks and Spencer's is a lovely shop to go in. If you've ever visited a Marks and Spencer's shop in the UK, particularly the small ones where you get your lunch, your sandwiches, you really feel good about yourself because there's posters on the wall telling you that they haven't harmed a single dolphin when they've been capturing and catching the tuna. They've eliminated trans fats from all their products, and there's no salt to be had in the entire shop. But as you line up to pay, here you can have Percy the pink piglet. That's in that one. There he is, Percy Piglet. You can have all these lovely sweets. And unless you've got an iron will and aren't feeling very hungry, you can't resist the flapjacks. Now, Marks and Spencer's, of course, not unusual in this. Retailers have used for decades ways of nudging us to buy things in shops, in supermarkets. They have it off to a fine art. The flip over is, can we nudge people to take beneficial health decisions, remains to be seen. I love this cartoon. Let's make the stairs more attractive and the lift less appealing. There are many blocks of flats in London where this is, and actually, even when you get in the urine-filled lift, it doesn't work anyway. So you have to use the stairs. And perhaps the stairs can be made more appealing in this rather Fred Astaire type of approach. A paper we published, a group that I worked with in Cambridge published in 2011, we began a series of projects trying to understand what makes up nudge or choice architecture. We call Judging Nudging, outlines some of the key issues. We undertook a major scoping review of the literature about choice architecture, around about 2 million hits in the literature review, to determine what there is to learn. Because you see, it's one thing, isn't it, to say, well, retailers have been using this for years. Vance Packard's book published in the 1950s called The Hidden Persuaders, that prototypes what nudge theory is all about. Or you can go even further back to the behaviourist psychologists, Skinner and Watson. They were doing stuff that we kind of recognise as responding to environments. But what's the scientific basis? What does the evidence actually say? Well, in that literature review, what we learned is there's quite a lot about food and nudging people in food directions in various ways, in choice architecture, about in restaurants and public houses. There's a bit about drinking, not very much about physical activity, and that was published as a paper in 2013, in which we outline what the key factors are in microenvironments to influence choices. These are the things which influence choices according to the scientific evidence. The ambience of a room, what it feels like, the furnishings, perhaps the music, the sound, the smells, the sorts of things that retailers use often very effectively, particularly if you like Muzak or endless versions of Vivaldi's Four Seasons as your basis for musical taste. The functional design of rooms or microenvironments, it affects the way that we respond and behave. The labels on products catch our eyes or don't. You know, when you see that lovely looking bottle of red wine on the shelf, which conjures up visions maybe of Australian summers or Italian lakes, an enormous amount of thought has gone into what's on that label. It's not just there by random or by accident. The presentation of materials. I went in a place yesterday, bad mistake for lunch. I arrived in Australia on first thing Monday morning, feeling a bit peckish, and I went into a thing that it said it was a pub. Anyway, so I went in and they gave me chicken schnitzel. What a mistake. This was sort of thrown at me as I sat down, and I've never seen such unappetizing, well, schnitzel of any kind really, chicken or otherwise, with a cup of gravy to pour on it and chips. I haven't seen chips like that for about 20 years. But anyway, I ate some of it. It was huge. That was huge. I wanted a little snack. Mind you, not as bad as going to the States. You go to the States and ask for a sandwich, it comes in a bucket. You notice that? And you don't have to eat for about a week if you don't want. Availability, if it's there, that's part of the sorts of things which and if it's close proximity, that works too. Priming us, setting ideas off in our minds about what might be useful or good. In supermarkets in the UK, if the products are on the gondola ends, at that end of the places you walk up and down, you keep after passing. It's priming you to buy or to put in your basket what's at the end. It's a form, if you like, of prompting. And we think this is what the literature says are the kind of key things about the way choice architecture works in micro-environments. These are the things which can be manipulated to make things effective. But there are other things going on in micro-environments too. The way we feel, our internal feeling states, as well as the social choice architecture. So internal feeling, subjective states, things like, very obviously, we're feeling fearful, tired, or we're in pain, skin sensations, if we're hungry or we're suffering from generalized anxiety, or many of the other hundreds of internal feeling states, that affects the way we respond. So it's not just the things that are there in the environment, it's what's inside us too. And of course, if there are other people there, as there most often are, what are the taken for granted assumptions about the social environment in question? The sorts of differences in the way that we might behave in a pub, or at high table in an Oxford college, or in a lecture theatre. In all of these things, there are different assumptions about what we do. Social interaction is an important part of the choice architecture, as of course our background culture, language, norms and values, and so on. In the UK, the Cabinet Office published from its Behavioural Insights team, the so-called Nudge Unit, a programme of things where they were trying out various forms of nudge activities with respect to smoking, organ donation, teenage pregnancy, teenagers who mentor toddlers, significantly less likely, they said, to become teen parents, a form of nudging, new devices to help children manage type 1 diabetes, that is, food hygiene, physical activity, social care, alcohol. In the Welsh universities, trialling new methods to encourage students to drink less alcohol using social norm techniques borrowed from work done in the United States, where you ask the student not how much do you drink, but how much do you think other people drink, your peers, and then telling them that they drink a great deal less than they think that they think, if you see what I mean. So if you believe that social norm is to go out and drink 12 pints of beer every evening, and you discover actually most of your compatriots are only drinking 4, that supposedly nudges you into a more sober evening. It's interesting actually to see that most of those things are relatively small scale, and what we really still need to see are what happens if you can do these things at scale. Can we produce the behaviour change on an industrial scale? But there is an interesting problem, I think, and I want to move to open up that problem now, because most of this stuff about behaviour change is premised on a notion that if I do something at X, it will produce an outcome at Y. And this goes right back to the early days of psychology. This is one of my favourite cartoons of Pavlovian conditioning. So the dog says to his friend, "Watch what I can make Pavlov do. As soon as I drool, he'll smile and write in his little book." Now, although we've moved a long way from simple notions of Pavlovian conditioning, the notion that human behaviour is predictable has stayed with us. And it's stayed with us in public health big time. And it's stayed with us in public health big time because of the history of public health. This cartoon from the Times, 1854, one of the years of the great cholera epidemics in London. And that's given us a sort of folk memory that germ theory gave a quick and easy answer. And I would suggest to you that the notion, if we can find the bacteria, as we eventually did with cholera, although long after the 1854 outbreak, not until the 1880s, if we could only find the bacteria, and we can therefore predict the outcome of not exposing ourselves to the bacteria, as we can do on the basis of clean water, we can do the same with behaviour. And actually, our great successes with smoking have served to reinforce this, because with the discovery that exposure to cigarette smoke was a direct cause of lung cancer, and all the changes that have happened since then, which have brought down rates of smoking in this and in most Western developed countries since the 1950s, this has given us the search for finding the silver bullet with behaviour that can do the same thing. But is human behaviour really like that? And can it be nudged? I hope some of you at least will recognise Inspector Morse. This is Inspector Morse shown on Australian television. So you'll know the routine with Inspector Morse. A body is discovered, and Morse goes along and begins a process of unpicking what might have happened. Morse, you'll note, as in many detective genres, doesn't try and predict what's going to happen next. Morse works backwards through one line of inquiry, and then another. Thank you. And then another. And with each line of inquiry, a new suspect appears on the left-hand side at X. And of course, the great beauty of Colin Dexter's scripts and the novels and the films is that we're kind of misled until the very end when it's revealed that it's actually the purple line and it's the person at X3 was the real perpetrator of the murder. I want to suggest to you that's a very natural way to think about the human condition. Most of us, when we ask ourselves the question, why did that happen? We don't do it on the basis of trying to predict the future. We do it on the basis of regressive inference, thinking backwards in that forensic way. So if you take a behaviour like alcohol misuse, and there on the right, one of my favourite Victorian cartoons, it's called Drinks Demons. And if you can see the poor man there suffering the throes of an unimaginably horrible hangover, with the demons drilling into his head, hitting with a hammer, and in various ways mistreating him. People experience the bad effects of alcohol for a range of different reasons. And those range of different reasons are the very different behaviours which lead to alcohol use. Most public policy in the UK thinks of alcohol use as a single behaviour, and therefore tries to think of solutions on the basis of a single intervention that will deal with the behaviour in toto, such as pricing policy. What it doesn't acknowledge is that, as I've got on the left-hand side of the slide, at the top there, a party. Beneath the party, in blue, that's Oxford winning the boat race in 2008, a celebration at the end of a sporting event. The third one, a graduation, a rite of passage. Alcohol is associated with many different rites of passage. Alcohol use is also associated with loneliness, depression. And in the bottom, the last of these things, a group of men in a pub in Dundee, where I used to work in Scotland, who went into that pub every day at 11 o'clock when it opened and drifted away at about 9:30 at night, having spent the entire day there drinking all day long. Now, what is obvious about that is that the behaviour in each of those photographs on the left-hand side is different. It's not a single behaviour at all. Alcohol use are many different and nuanced forms of behaviour, some of which don't require state intervention at all, some of which perhaps do. The common errors associated with trying to predict behaviour, it seems to me, can be reduced to these 6 bullets. It's common sense. I've heard politicians say this so many times. We know what's bad for us, let's just stop doing it. No, it doesn't work. Well, it's about getting the message across, appealing, as I said earlier on, to people's cognitive capacity. Because knowledge and information drive behaviour. Well, yes, some knowledge drives behaviour and some information does. But lots of behaviour, as nudge theory demonstrates, is a response to immediate cues in the environment. Well, people act rationally. Well, yes, they do sometimes, but often they don't. People act irrationally. Well, no, that's not true in toto either. But the most important error of all is the one that suggests it's possible to predict accurately on the basis of some preconceived idea about general behaviour, as with alcohol. I prefer to suggest instead that we need to think about behaviour not as an individual thing, but rather like what some sociologists call a practice, made up of 3 elements. The materials, the things you need to do the behaviour. You can't smoke unless you've got a cigarette. You can't drink unless there's alcohol. And all the consumer goods and infrastructures that go with it. You need an industry to supply the tobacco, to supply the food, to supply the alcohol. It just doesn't happen You need competence to do the behaviour. I don't know if anyone in the room ever was a smoker, but if you were, you remember the first time you ever inhaled a cigarette. It's utterly horrible. It makes you cough, it makes your eyes water, probably makes you feel sick. But the grip of the nicotine is sufficient to get you past that. It requires a certain competence to learn to enjoy that feeling of lightheadedness and so on. And then the third element, the meaning embodied in the practice. Because just think, you watch those old films from the 1940s and 30s, the way smoking is represented in them. It's glamorous, it's sexy, it's powerful, it's tough. We've moved on a long way in terms of the meanings of those things, to the point at which, in Britain at least, if someone is a smoker, they're marginalised. They have to go outside to do it. You can't do it in polite company any longer. And the materials, the competence and the meanings are linked together. If we're going to change practices, as we have so successfully with tobacco, it is because we've broken the links between the materials, the meanings and the competence. We've broken the links between the lines on those different elements in the practice. This is a difficult concept, I think, because it's not an easy thing to get across. If you start saying, well, think of smoking as a social practice, it's something that existed 200 years ago. It will continue to exist in a different form in 100 years' time. And it's not the individuals that do it. Individuals are recruited to it, and then they stop doing it, either because they die or they manage to stop doing it. The same is true of all of the things of interest here with non-communicable disease, be it eating, physical activity, or alcohol consumption. And if we think about these things as made up of these different elements, rather than trying to predict on the basis of sometimes rather naive thinking about the nature of human behaviour, we might make better progress. It's important, as I said I'd return to at the end of my talk, the question of health inequalities. One of the great things that troubled us at NICE was this: if our public health interventions worked, and they worked well, we managed to improve the health of the population as a whole. But improving the health of the population as a whole does little, or in fact nothing, to change the relative inequalities across the class system, across the health inequalities gradient. But worse, many health interventions, particularly those that are based on engaging with the cognitive competence of people, which require certain educational skills, for example, has the effect very often of improving the health of those already in the best of health more quickly, and actually making absolute inequalities as well as relative inequalities worse. What we seek to try to do is shift the gradient in that direction, to swing the gradient so the health of those most in need improves fastest. But in order to do that, simple solutions don't help you. You have to have a very detailed understanding of this concept on the graph I've called social status, the very nuanced and highly variegated nature of the social world which people live in. Generally speaking, the concepts we use in epidemiology are far too coarse to do that. Using occupational grouping or something like that as the basis of our categorization misses all the nuances and the subtleties of multi-ethnic, multi-complex societies. And unless and until we get better at understanding that, of working like Inspector Morse back into the things which determine the behaviours that people engage in, and take seriously the reasons which people give for doing those behaviours, we won't get very far. So my final and concluding comment is that if we are to address the question of non-communicable disease using methods which are about changing behaviour, we actually have to think about behaviour in a rather different way. Nudge may well be part of it, and we can change architectures to make things and make a difference. But it is only one part of a much broader spectrum of things that we need to do, which probably engage with all of those points on the Nuffield Ladder of intervention, and which do require that we take a multi-pronged, multi-layered approach, just as we've done with tobacco. Finally, we have to remind ourselves, though, Dolan Hill's first paper demonstrating that link between exposure to tobacco smoke and lung cancer appeared a year before I was born, in 1952, 60 years before in England we got the smoking ban. 60 years where there was a single pathogen involved, tobacco smoke. With food, with alcohol, and with physical activity. It's not a single behaviour, it's not a single pathogen, it's a much more complex thing, a much more complex picture. So to echo Daniel Kahneman, we need to engage in some perhaps very slow thinking about the complex matters involved. Thank you.